Well, thank you all for being here today. We, of course, here at Long Beach want to ensure that we're providing everyone in the community across the county and the region with accurate information as it relates to COVID-19, or as a lot of folks know it, referred to as the coronavirus. The City of Long Beach today is releasing that we have 3 confirmed presumptive cases of COVID-19, which is, of course, pending final confirmation from the CDC. It's important for people to know that while those tests have come back as positive, it's not until the CDC confirms those cases that they become official through the CDC confirmation process. But they have all 3 tested positive. We understand that this is certainly unsettling for our community here in Long Beach, but please know that we are doing everything that we can to ensure public safety, that we're reviewing all the information that we're gathering from our partners, and of course, coordinating with all of our medical personnel here across the city as well as the county. Our health department is currently right now assessing and going through an extensive investigation to identify and minimize the spread associated with these cases and of course others that may arise in the future. We have been preparing for this for many months and weeks. We just held a briefing not too long ago to ensure people that they knew what was happening across the city. And we just, of course, recently also declared a state of emergency here in Long Beach, coinciding with the state of emergency at both the state of California and our regional and local partners. It's important to note that Long Beach is preparing aggressively, and also that we understand that this is a very serious global health public crisis, and that we are taking it with extreme caution and seriousness. Long Beach residents across the city and of course all of our partners in the region and the county need to stay informed. We also want to note that the city is in constant communication with our partners. This of course is the CDC, the California Department of Public Health, LA County Health Department, our hospitals, of course, who are dealing with the crisis, our urgent care centers, and our local providers that are directly working with people across the city. I also just want to note that we have a very important relationship and communication effort with our public school system, the Long Beach Unified School District, our community college, and of course Cal State Long Beach. You may have read today or seen reported that 10 students and 2 staff members from Cal State Long Beach have self-quarantined. That was reported today. That is the case, as we're all aware. Those are not related to the 3 cases that we are discussing here tonight. I want to note that the city is being incredibly proactive as it relates to COVID-19. The Long Beach Airport is undergoing extensive cleaning and extra disinfecting of public spaces. We're making sure that hand sanitizers on all of our public facilities are clean and that we're providing them. We're working with our major employers across the city. And of course, the port is a big partner working with our federal partners as well. I will reiterate, since we've been asked, that once again, ships coming in from China are not being disembarked. And so workers on those ships are staying on their ships and they are not disembarking into the city, both here in Long Beach as well as in Los Angeles. All of these steps are aggressive, but they're appropriate given the situation. And I want to remind folks, before I turn this over to Dr. Davis, that it is very important that you wash your hands with soap and water for at least 20 seconds, that you're avoiding touching your eyes, nose, or mouth with unwashed hands. And if you are at home, if you're sick, to please stay home. If you are sick, please stay home. And we're actually even encouraging folks, if you can, give folks a fist bump if you really feel you need to shake someone's hand. It's a much safer way right now. And so I'd like to turn this over to Dr. Davis to get more information about the 3 confirmed or the 3 positive cases that we have. I'll turn this over to her.
Thank you, Mayor Garcia. So now that we have, I'm Anissa Davis, I'm the City Health Officer for the Long Beach Department of Health and Human Services in the City of Long Beach. So now that we have 3 presumptive positive cases, we're conducting extensive contact tracing to determine who else may have come in contact with these individuals, as well as identifying the potential sources of the infection in these cases. The cases are considered presumptive until the Centers for Disease Control and Prevention has confirmed the results. 2 of the cases recently returned from a cruise ship on the Nile River in Egypt, where other cases of COVID-19 had been reported on the ship. 1 patient had traveled to an area with known community transmission in Northern California. In response to these cases, we are actively tracing the whereabouts of the patients while infectious, contacting and monitoring close contacts of the patients, working with local healthcare facilities to monitor healthcare workers who may have been exposed. Additionally, we continue to be in constant communication with the Centers for Disease Control and Prevention, the California Department of Public Health, and other state partners, local hospital emergency departments, urgent care centers, and local providers to obtain and provide the most updated guidance regarding COVID-19. At this time, health officials are not recommending the closures of schools or other public facilities, and if that changes, we will provide further instruction. However, like the mayor said, we're encouraging all to prepare, not panic. All communities can take measures to reduce the spread of COVID-19. Everyone has a role to play in getting ready and staying healthy. So again, to reiterate, our community should continue to follow the general health practices. We can't emphasize them enough because they are so important. Wash your hands with soap and water often for at least 20 seconds. That's the birthday song twice. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touched surfaces and objects. Stay home if you're sick. And if you have underlying health conditions or are an older adult, consider avoiding large gatherings for the time being. If you have symptoms such as coughing, fever, or difficulty breathing, please call rather than visit, if you're able, your healthcare provider immediately to receive further instructions. It's also important to make arrangements if you or a family member should need to stay home. So periodically check your regular prescription drugs to ensure you have a continuous supply in your home, have non-prescription drugs and other health supplies on hand, and talk with your family members and loved ones about how they would be cared for or how you would be able to care for them in your home if necessary. Thank you.
The next individual I'd like to bring up is Deputy Fire Chief Matt Greniason.
Thank you. To help prepare Long Beach, Acting City Manager Tom Modica activated our all-hazard incident management team on March 5th, 2020. The following day, the Joint Information Center was activated to provide the community as well as the media the information up to the date and up to the hour as soon as we got it. We have multiple city departments working together around the clock to monitor the situation. We are in close coordination with our local, state, and federal partners, and we share updated information, coordinate resource, and ensure the continuity of the regular city operations. We are also working collaboratively with health officials to implement enhanced health information, enhance health and safety measures to limit the spread of COVID-19. We encourage everyone to stay informed. Our city communicates regularly and often. Their communication team is staffed with the Joint Information Center and is continuously sharing information as it becomes available. For local and up-to-the-date information, please visit the website, longbeach.gov/COVID-19, and follow us on your socials, Facebook, Twitter, Instagram, and YouTube. The Long Beach Health Department information line can be contacted Monday through Friday from 8 a.m. to 5 p.m. That number is area code 562-570-INFO. Once again, that's 562-570-INFO. Thank you.
Okay, we're going to go ahead and just do some just remarks in Spanish, if folks don't mind, and so we're going to go ahead and just do that. Estamos acá en la ciudad de Long Beach para hablar del coronavirus. Sabemos que hoy día en la ciudad de Long Beach ahora tenemos tres casos de la coronavirus. De esos 3, ahora en la County de Los Ángeles hay un total de 19 personas que tienen, que en el test están positivos. Ese test todavía tiene que tener una confirmación del CDC, del gobierno federal, pero tenemos nuestros primeros 3 casos acá en la ciudad de Long Beach. Estamos diciendo a la comunidad que por favor, si tienen síntomas del coronavirus, que por favor se queden en sus casas, que hablen con su médico o un hospital, y también que por favor se laven las manos para 20 segundos todos los días cuando salen, cuando están yendo al trabajo, y también por favor que si ellos sepan o si saben que tienen familia o personas que ellos conocen que también están en la comunidad, que también están enfermos, que por favor se queden en la casa. Nuestro departamento de Health, nuestra ciudad, nuestros policías, los bomberos, todos estamos trabajando juntos para poder dar la información a la comunidad. Vamos a continuar a dar información a la comunidad. También sabemos que estamos trabajando con nuestras escuelas, la universidad, estamos trabajando con el gobierno federal, el estado, el Governor Newsom y toda la comunidad en el estado para trabajar en esta situación. Y también déjame decir a la comunidad también que yo sé que hay un reporte que hay estudiantes en la Universidad Cal State Long Beach que capaz fueron a un evento donde había gente que tenía este virus. Y que sepan, por favor, la comunidad que esos 10 estudiantes no están conectados a esos 3 casos que tenemos ahora. Es una diferente situación. Y esos estudiantes no han tenido un test que es positivo, pero están en la casa cuidándose. Eso es todo por ahora, pero vamos a continuar a poder dar información. Muchas gracias. Thank you guys very much.
All right, so just real quick, we'll finish up with some closing comments. So you can see that behind me here, we are sitting in the incident command post of the All Hazards Incident Management Team that was activated by Acting City Manager Tom Modica. The city has created a unified response, not only here at the Incident Management Team, but also with the Joint Information Center. We continue to keep everyone apprised of developing situations in close discussion and relationships with all of our partners, including the Health Department. Continue to be advised of things that are continuing to develop here in Long Beach by following us at www.longbeach.gov/COVID-19. If the community has any questions, please have them contact us at 562-570-INFO. We'll continue to do our best to keep you informed, continue to keep you up to date. But remember, preparedness starts with you. Each and every one of you have an opportunity to make a difference in preventing the spread of COVID-19 in the city of Long Beach. Please wash your hands, and if you're sick, please stay home. Thank you very much.